Hi everyone, welcome back to Dr. Carri's Clinical Corner. I haven't posted in a while because I've been busy and also just thinking of topics, but this really came to mind recently, and so I wanted to make a video about it and the importance of getting a proper diagnosis. So a couple things. As a pelvic floor therapist, I see a lot of patients who their doctors still don't refer them to pelvic floor therapy, and I'm hoping that's the future. You know, I think about orthopedic things, like if you tear your ACL, if you have knee surgery, you get physical therapy, right? So if you just have like knee pain or back pain, oftentimes it's physical therapy and then we'll do surgery or other things. So I'm hoping one day in the future, pelvic floor therapy will be like that, but as of now, we're not there. And I think part of it is in pelvic floor therapy, there's no test for muscles, right? And for anything physical therapy, there's no test for tight muscles or weak muscles. There's no test per se, as in like a blood test, an x-ray, an MRI. It doesn't show that. It's sort of like by observing, by testing clinically, which I feel like in our American healthcare system, that's like not what doctors do. So I think that's part of the problem. And then what happens is people do their own research, right? Their own Google search, YouTube search. And this is where I see a problem, is people are like, okay, I think I have X diagnosis, right? We'll take bladder leakage as an example. Everything you're going to find is going to say Kegels, which the message is changing, but generally it's like, do Kegels. And that's not always the answer, you know? And then recently I had a patient coming who swore to me she had plantar fasciitis. She had symptoms in her foot, right? And I was testing and I'm like, it doesn't really fit, you know? And then it's like, oh, she has sciatica actually, is what she. And so this is the part that I'm like, it's so important to get a proper diagnosis, because for a lot of my patients, they're Googling their symptoms, they're doing exercises they found online for months, and things aren't changing. And so for this sciatica patient, you know, that was a really good example. She's like, for 6 months, I've been doing these exercises and they help temporarily, but not really. And it wasn't consistent with plantar fasciitis. And then I was like, let's do some other tests. And I was like, oh, I think you have a nerve problem, a sciatic nerve problem. Gave her the exercises for that and the treatment for that. And she walked out like, oh my gosh, I feel so much better. And the next week she's like, I haven't felt this good in 6 months. So often in the business side of things for physical therapy, they're like, you know, you're not paying for my time in minutes, you're paying for my time, my expertise, which I absolutely believe that. I don't like that marketing message, but I absolutely believe that because, right, if I'm on YouTube and I'm on social media, I'm on the internet, I'm doing all these exercises for what I self-diagnosed, but if that's the wrong diagnosis, I'm not going to get better. So again, I see this also very commonly in pelvic floor therapy. If I diagnose that I have bladder leakage, that's like a pretty easy diagnosis. But the thing about bladder leakage is, why do you have it? So it's not always weak pelvic floor muscles. Sometimes it is. Sometimes it's tight pelvic floor muscles. Sometimes it's hip weakness. Sometimes it's bladder habits. It's a lot of different things, which I cover this in my free bladder course. Side note, if you want to take that, I'll link it below. I also have a full online bladder course that goes over all of the things and how to figure out what is the problem for you. But really getting the proper diagnosis, that's how you start fixing the problem. So yes, finding someone who can diagnose you correctly, and then you can get on your way. You know, I'll give you another example of like a more complicated patient. So her problem was bladder leakage with exercise. Super common thing I see in my office. And she had gone to pelvic floor therapy. They only gave her Kegels. It helped to a point, and then it didn't. And they were like, just keep doing Kegels. And she's like, shouldn't this be getting better? So fast forward, some time off, she came to me. And I'm like, oh, you have tight pelvic floor muscles. So this is actually a super common thing I find, especially if you've tried Kegels for bladder leakage and it's like, oh, actually you have tight pelvic floor muscles. So we're working on that. And then she started to have sciatica symptoms. So I see a lot of sciatica, even though I'm a pelvic floor therapist. And then it kind of got to the point like her sciatica was taking over everything. And so we had to fix that in order to fix the pelvic floor problems. And I see this commonly in pelvic floor therapy is like, if there's sciatica, if there's a hip issue, sometimes back pain, we have to fix that in order to be able to fix the pelvic floor problem because our pelvic floor muscles are really small and sometimes they're trying to do the job of bigger muscles. And so we have to look outside the pelvic floor and work on the bigger issues in order to help the pelvic floor. So that brings me to another thing, and this is more on the clinician side. There's something called confirmation bias. So if a patient comes to me and says like, I have bladder leakage, I have pelvic floor muscle weakness, and I'm like, okay, we're gonna do Kegels, I might miss that they have tight pelvic floor muscles. And so when I do pelvic floor exams in the clinic, I always tell people like, we're always gonna test both ends of the spectrum of like, is there weakness or is there tightness, right? And if there's tightness, sometimes it's like, why is there tightness, right? Especially if there's tightness because of bladder leakage. If there's tightness and the symptoms are pelvic pain, that makes sense. But if there's tightness and the symptoms are bladder leakage, often that means the tight pelvic floor muscles are compensating for something bigger, a weakness in the leg, a back pain, something else, a weakness in the core, something else. And so confirmation bias would be like, oh, you have bladder leakage, so we're just going to do Kegels. But what we're taught in school is do all the tests, right? And so that's what I do with my pelvic floor patients is like, we're going to do all the tests. And if something doesn't make sense to me, I'm going to do more tests, right? And so with a recent patient that I talked about who swore she had plantar fasciitis, she'd been doing plantar fasciitis exercises without really any lasting relief. So that's a signal to you, like maybe you don't have the right diagnosis if you're not getting lasting relief. So if I would have just believed her and said like, okay, we're going to treat plantar fasciitis without testing other things, I would have totally missed it. But to me, I was doing the test for plantar fasciitis and they didn't really make sense. So I'm like, let's test your hip, let's test your knee, let's test some other things. And then I'm like, oh, I think you have sciatica. We treated it for that. She felt much better after one visit. So it's not like one and done, but as a clinician, confirmation bias is like, I'm just going to treat the things that I think it is based on what they told me or what the patient thinks or whatever it is, and I'm not going to test other things. And I think we're all guilty of that at times. But in my mind, if you're not getting better consistently, then we're missing something and we got to retest. So that's sort of like how to not fall into confirmation bias is, okay, and to me, it's like within like 3 visits, if things aren't getting better, then, okay, let's go back and retest. Let's try something else. Let's test something else, right? If I only worked on the pelvic floor, maybe now we got to test your hip strength, your leg strength, your core strength, your flexibility of your back and your legs, like other things. So that's how we get out of confirmation bias is test. And the test overall, so in physical therapy, we sort of say like, we call it like we have a battery of tests. We have like all these different tests. We test strength, we test flexibility, we touch the muscles, right? Things like that. And sort of all of them together should tell us like, this is the problem. So if sort of like they don't fit together, then it's like, maybe there's something else going on. And so as a consumer of health, what I would say to you is if you're self-diagnosing, like, okay, I Googled my symptoms and it told me I have sciatica, right? And you're doing sciatica exercises, but your symptoms aren't getting better within like a week or two. And not to say like they're all gone, but I would say if like within 2 weeks, it's not getting better consistently or like little by little, then maybe you don't have the right diagnosis. And maybe it's worth a visit to a physical therapist, a doctor, a chiropractor, some professional that has more knowledge that can test these things for you. Yeah, so that's really like, that's what I hold myself to also, is sort of like some of my patients have chronic conditions that are not necessarily going to get better every week, but if the overall picture is not improving, then like maybe we're missing something. An improvement can be my symptoms are less, I have less pain, I have them less often, I recover quicker, so when I do get flare-ups, they don't last as long. Those are all ways that we measure progress, and I hold myself to that too. If I'm working with a patient and like in 2 or 3 visits they're not getting better, I start to question like, maybe you need to see a doctor, maybe we need to treat something else, maybe you need to, I don't know, see a chiropractor, like, I don't know, it depends on what it is. Or maybe this is just not the thing or not the time. But chronic things are a little bit more challenging because it's not going to be straightforward like, oh yeah, I have less pain. It's probably going to be like my pain is less intense, or it's less intense for some times and then it comes back. So chronic pain is obviously going to take longer. It's a little bit trickier. But still, in general, it should follow the pattern of like, I have less severe pain for less amounts of time, right? I have times in my day I have less pain. I could do things with a lesser amount of pain. Or when I have flare-ups, they don't last as long, or the pain is not as intense. So that's sort of like pain as an example. But bladder leakage also, like, I have less urine leakage, it's a smaller amount. It doesn't happen every time. Those are signs of progress. So yeah, that's what I would tell myself. I tell myself, to other clinicians, and to consumers. So if you're not seeing change within a couple weeks from whatever you Googled or saw on YouTube, then maybe it's time to see a clinician, have them test you, and maybe you have a different diagnosis. Because without the proper diagnosis, we're not going to fix you, or it's going to take way longer to get there. But yeah, we have to have the proper diagnosis, so we're treating the proper thing in the proper way for you to get better. So that applies to whatever it is: shoulder pain, neck pain, back pain, pelvic pain, bladder leakage, anything. And this is just sort of from like a muscle perspective, but also from a medical perspective too. It's like, if things aren't changing, we got to keep investigating. So investigating in a physical therapy sense is testing muscles, testing movements, testing strength, flexibility, things like that. It's not testing like blood test or ultrasounds, things like that. But those are also important, right? To see, like, make sure it's not something more medical. But I wish medical doctors, if they can't find a diagnosis on paper from their tests, I wish they would refer to physical therapy more often to say like, hey, maybe it's a muscle problem, maybe it's like a function problem, right? Sort of physical therapists, we think of what we do as like muscle and function, movement. Yeah, and pelvic floor therapy helps with those things. So I hope that helps. Get a proper diagnosis. Give yourself a week or two to feel improvement. If not, then you probably need outside help, and whatever you're researching is probably not the proper diagnosis. Same thing if you're going to physical therapy and it's not improving in a few weeks, at least some improvement. Maybe we got to check out something else. You got to try a different physical therapist or a different practitioner, or go back to your doctor. So those are my guidelines for you. Get a proper diagnosis. It should start to improve within a few weeks. Okay? I hope that helps. If you have any topics you want me to discuss, leave them in the comments, and I will see you next time.